Wait, shouldn't every explant get a total capsule removal? Don't the toxins causing BII remain in the capsule? No, and let's talk about it. So first of all, there is no known cause for BII. Breast implant illness, now known as systemic symptoms from breast implants, or SSBI, does not have a known singular cause. It's almost certainly a combination of things. So there's not one thing that causes breast implant illness. And there certainly is zero data that any particular toxin causes symptoms with your breast implant. There is no data to support that. There is no data that toxins are in implants, leach out of implants, get into your capsule. None of that's true. Now, there have been some infographics that have been shared in some of the breast implant illness and explant groups that indicate that there's heavy metals in implants, and these are the toxins they're talking about, but this has been shown not to be true. So there was a great study that was done several years ago where they looked at women with breast implant illness symptoms, women without breast implant illness symptoms that have implants, and also women who were having breast surgery with no implants at all. They checked heavy metal levels, and there was no difference. Now let's talk about capsule removal for a second. So although this was commonly done for quite some time with patients that have symptoms from their breast implants, there have now been multiple studies in multiple countries, not sponsored by industry, that have shown that this does not help you. So if you are a patient who has symptoms from your breast implants, if you have your implants removed, or if you have them removed with the capsule, there is no difference in your rates of recovery. So the capsule removal is not needed and not recommended, and should not be recommended for that reason. Now, there of course are reasons why we remove capsules. So some patients have severe capsular contractures, ruptured silicone implants. These patients should have their capsules out. A soft indication would be textured implants, especially the biocell textured implants, because of ALCO risk. We don't know if that's the right thing. It may not be, but I don't think it's unreasonable. But if you're being recommended removal of the capsules to minimize your breast implant illness symptoms, you're being led astray, and you should run away from that doctor. So women with systemic symptoms from their breast implants deserve the same high-quality, evidence-based care that patients with all different sorts of medical problems get, and they have not had that in the past. They've had charlatans that prey on them, prey on their fears in order to profit off of them. So if you see people saying these things, especially if it's a surgeon, please, please, please report them to their medical board as well as their board certification, because it's unacceptable. Women deserve better.